Hello, my name is Sophia, and along with my partners, Alyssa, Mustafa, and Anthony, we are Group 4, and we will be presenting 3D augmentation in medical training. We will discuss the history of 3D augmentation, examples that 3D augmentation are currently being used for in the medical field, the controversies surrounding 3D AR in medicine, as well as the future goals for 3D augmentation within the medical field. So let's get into the history of augmentation. The initial idea came about in 1935 when Stanley Weinbaum wrote Pygmalion Spectacles, which gave the initial idea of a virtual reality system where the character had worn an eye set that would essentially show them a movie, and the participant was able to see and feel this movie with all of their senses as if they were inside the movie. So this multimedia device came about in 1957, and the first augmentation reality device was created in 1968 as the first head-mounted device created by Ivan Sutherland. As the augmentation reality topic started to pick up, a lab was created dedicated to artificial reality called VideoPlace. This was created by computer researcher and artist Myron Kruger. So as augmentation reality was already being worked on, the actual term augmentation reality was not coined until 1990 by Tom Caldwell. NASA later utilized this augmentation reality in 1999, creating a hybrid synthetic vision system. This similar idea was later embedded in the entertainment and gaming industry in the early 2000s, and is what we recognize as the AR and VR systems that we have in gaming today. But right before then, augmentation reality became a leading gold standard in mental health treatment. This AR system became an exposure therapy, assisting as a cognitive behavioral treatment. This essentially means that the AR system was created for repetitive and systematic exposure of a feared stimulus so the patient would become acclimated to the anxiety-induced stimulus. This therapy has been used for over 20 years in clinical healthcare, moving towards brain assessments and pain management, such as in burn victims or phantom limb pain. Furthermore, we will discuss current examples we have in the medical training field today in the next few slides.
Current uses in medical training. Day by day, 3D AR is impacting healthcare in many ways, and I chose to focus on the surgery part as a few of my examples. Researched about a software developed by MedSites Tech, which allows surgeons to create precise 3D dimensional reconstructions of tumors, which allows the surgeons to access X-ray views without any radiation exposure. So I found this MedSite link in the website medicalflorist.com, provided me with a lot of examples of 3D AR uses and the way it impacts our medical training. And there was actually a significant amount of impacted not only just actual healthcare workers, but obviously the future generations of the healthcare programs. And in addition, the more research I did about the MedSite Tech, I realized that this is actually a very efficient and a way to have surgeons work done more precisely and with very little error made. So for the second example that I put in my slide about the current uses in medical training, I decided to study an app that Microsoft has created, which in my opinion does a very great job in getting rid of the old teaching method of just having students and medical professionals look at papers of pictures and descriptions to learn about medical field and the body parts and all the necessary information that you need to learn. And Microsoft created this app, which is a headset that you put on, and it pretty much shows you anything from the tiniest vein to any muscle in the body, and you pretty much just see it in a clear view, and it's all right in front of you, and you look around and you see these muscles and veins, and you see them like you would in the real world, obviously on a piece of paper and like on a drawing. You're kind of just seeing it in a two-dimensional form, but with the HoloLens, you're actually seeing everything in the order that it is in the body and where everything would be located next to each other, which I think was really, really interesting. And I definitely believe that this is a very impactful training aid for the future medical professionals and just the future students in general taking any medical classes. And I definitely feel like this would create a more interest to the medical profession. So the final example that I am using in my current uses of medical training slide is a company called Accuvane, which is really amazing AR technology that is assisting with one of the main problems that a lot of nurses and doctors have, which I researched on the same link, the medical futurist is. And as I put in my slide, having a nurse poke at you with a needle isn't fun or pleasant. So this article definitely put a smile on my face for my next future doctor's appointments. So pretty much Accuvane is using AR technology with a handheld sensor that projects over the patient's skin and displays the location of veins in the patient's body to the nurses and doctors. Just the doctors and nurses are not just sticking a needle in you, and but there's been a lot of times when I've got shots and stuff like that, and the doctors did a great job of getting everything done on the first try. But also there's been copious amount of times of I definitely think that this is a great tool for medical training and for the medical field in general, because so I definitely believe that this is a great teaching aid and a great tool for the medical field. And also, I read an Accuvane marketing specialist, Vinny Luciano, claims that this technology has been used more than 10 million times, and that makes locating a vein on a patient on the first stick for a nurse 3.5 times greater, which is a very big increase, and that definitely is making more people happy with not having to get poked at a lot, and giving IVs and shots and all of that way more.
Since the use of augmented reality in medical training is a recent phenomenon, the controversial nature is in its beginning stages too. Its use opens so many possibilities for current and future medical training programs, and it will hopefully over time improve the safety of medical training, the overall cost of medical training, and the depth of understanding that each new generation of medical professionals acquires during their education. A couple of important benefits to note are that AR is really beneficial during times like now where a pandemic is going on and in-person isn't always viable in the least, and it's not necessarily the safest option. So AR increases the ability to still be training new medical professionals in times like this. Another thing is that it expands the opportunities to be trained through different situations that can occur with patients without those situations being present and legitimate dangers to actual patients. Of course, it's assumed by many advocates of augmented reality use in medical training that these benefits in currently implemented programs are already being witnessed and embedded within these newer professionals. However, this remains somewhat of a gray area as far as the full conclusive data on augmented reality impacts is still a ways off. There are many factors we currently have limited knowledge on, and the conclusive evidence will take time to gather and analyze. The long-term scope of AR on medical training won't be witnessed until at least a significant amount of longitudinal studies have been completed. As of now, all possible downsides of AR are more speculation than actual controversial downsides.
All right, and I'd like to conclude with the future of augmented reality in medical training. The future is bright when it comes to augmented reality in medical training or medicine in general, because it would bring forth many opportunities for furthering the reality of transforming hospitals. To further explain, the introduction of augmented reality within surgery suites, for example, would bring revolutionary changes by allowing there to be a better visualization of the part being operated on. For example, an Israeli startup called Augmetics had created an augmented reality headset for spine surgeons, so they would be able to have a model of the CT scan of the spine, so the surgeons can have some kind of a X-ray vision, quote unquote, to allow there to be a better visualization of what they would be operating on, in this case, the spine. Now for my next example, for the future of augmented reality in medical training, I'd like to focus on a company called Proximy, where they implement artificial intelligence, machine learning, as well as augmented reality into places like surgical suites, which allows there to be a sort of a gain of knowledge when it comes to the learning experience you would get in regular surgery sessions. You would be able to have this as training applications as well as programs for you to further your experience, not only just by shadowing a doctor to begin with. Proximy is already used in 250 operations every month across 30 different states, which is only the stepping stone for the future aspects of what medical training could look like under augmented reality. Once augmented reality takes lifts off, that will help bring forth even further revolutionary traits in terms of medical training. This would be the references that we had for the presentation. Well, thanks for listening, guys. My name was Mustafa. My other group members were Anthony, Alyssa, and Sophia. Thank you guys for taking the time to watch our video.